My name is Kellyanne Tensley. I'm the team leader for Brisbane Domestic Violence Service. COVID-19 has impacted our participants in many ways. For some women, having to return home where the perpetrators are residing and the kids not being at school. For others, they've been cut off from their community supports, not able to go to the library and meet with us or go to the coffee shop and talk to a friend about what's happening at home. So this has significantly impacted on our ability to connect with women for safety planning and exit planning, and we've had to be creative in the way we work. Our staff here at BDVS have all grouped together, working tirelessly to ensure that we're getting to the calls which have increased during this period of time, and working in collaboration with our system partners to find creative ways to support women and children to exit to safety. One of the areas we've seen the biggest impact is in our Safer Lives mobile outreach service. We're fortunate the Safer Lives mobile outreach team were able to still continue to deliver service using their protective gear and going out to the motels and providing support to women and children. Many women during this time decided that refuge was not an option for them, so working more broadly with the Micah services and the Department of Housing, were able to bring women into temporary emergency accommodation. This has been an excellent option for women, particularly with borders being closed and limited travel throughout the state. One of the issues which came to us at Brisbane Domestic Violence Service in the early days of COVID was that the miscommunication in the community had left women confused over what services were open and what services were closed. So we spent a lot of time ensuring that our social media was up to date, shared campaigns throughout our networks, and working with other organisations to get the message out to women that our service was open, accessible, still face-to-face should she need it, via telephone or via a digital platform. Over the last 8 weeks, we've had significant complexities in working with women, primarily due to a lot of support services being closed within the community and children being at home from school. This has meant that we've had to be really creative with our safety planning and use a lot of government services that were still open as points of contact for women to safely be able to call us, or in some instances, exit with their children. We run several groups here at BDVS, and during COVID-19 we've had to change our way of delivering these groups. So in our men's behaviour change program, we went to individual telephone support within the first few weeks, and within our children's and young persons program we went to digital platforms. We've seen an increase of engagement with children and young people who are really liking to use the FaceTime as a method of contacting our service and working with our staff. It really has been a privilege to watch the team adjust, be flexible, be creative and work collaboratively to ensure the quality of our service has not been impacted, and that we continued throughout the period to provide support to help women and children facilitate safety in their home or through exiting.